Okay, this video is the health of doctors I have seen. And this includes a bunch of doctors. I've known hundreds, thousands of doctors in my career, but these are the ones who I have seen what sort of has happened to them. I've seen the before and after on them. And I can tell you that, for example, I knew this one female doctor, kind of average intelligence, ate the typical diet, was a little bit fat. All of a sudden, she dropped dead. Okay? I knew another very smart female doctor. She was very beautiful as well, MD, PhD, but she was a little bit neurotic, okay? And sometimes people like that get jealous of me. She was very jealous of me, like intensely jealous of me. People will say things like, well, if I had your opportunity, I would have gone to Harvard too. And I'm just like, give me a break. But anyways, she got cancer, breast cancer. I offered to help her, but she didn't want help. She just wanted to go to a specialist. She took chemotherapy and she was dead very quickly, like in 3 years. Terrible complications from chemotherapy. I knew another smart female doctor, and she got cancer too. I don't know, I think it's breast cancer. I don't know the whole story about it, but it's a significant cancer. Some of her friends talked to me about it. I offered to talk to her, but she's going to a specialist. I don't know what's going to be her outcome. I know some stupid female doctors that are very fat, hypertensive, and diabetic. In general, what I've noticed is a pattern that the typical female doctors, they stay skinnier. They're better at staying skinny. They look a little healthier than do the average nurse or technologist. And the average nurse or technologist tends to be skinnier than the average secretary. There's lots of exceptions to this. Some of the secretaries are really skinny. Some of the doctors are really fat. But in general, that is true. I've seen another thing that kind of shocked. Well, I'll tell you the doctors who have made the biggest health turnarounds. It's actually quite rare to see a doctor make a health turnaround. I don't see too many. I'm surprised I don't see more of them, but I have seen a couple of them. I'll just give two examples here. Very smart male doctor was quite fat in his mid-50s, early to mid-50s, went low-fat vegan, 100% cured himself. He learned about McDougall and Kempner and all this stuff. I knew another really smart guy, businessman, and he actually flew across the country to talk to me because he had coronary artery disease, chest pain, had been stented, and he wanted to understand coronary artery disease, and he felt that he was missing something. I told him to go low-fat vegan. He's been fine ever since with no problems. I knew another male doctor who's considered a genius by the people who know him well, and he's fat, hypertensive, and diabetic. And I'm like, well, what the hell is wrong with him? Why won't he read about the low-fat vegan diet and cure himself? And they go, oh, well, he's too busy. I'm like, well, that's bullshit. If you're too busy to maintain your health, then you're not that smart, okay? Because it's pretty important. Another smart male doctor, pre-diabetic. Oh, he was fat, pre-diabetic and hypertensive. I taught him the low-fat vegan diet, and he cured himself. He lost all the weight, and he was doing great. But then I didn't see him for a while. He went back to the Mediterranean diet, and he had a big stroke, and he died. In general, I also know some male doctors who I think are eating a Mediterranean diet. I don't talk to them that much, but they're pretty healthy. I'm kind of surprised how healthy they are. At least they look healthy. I don't really know what's going on with them. In general, most doctors are eating some version of a Mediterranean diet. The Mediterranean diet is what typically they're eating. They're typically not eating that much of a sad diet, just regular processed food and junk food and fast food. But they're still not eating that well, would be the typical one. And they don't know nutrition, epidemiology, and toxicology. Let's see, what else do I see? A lot of them end up going for hip replacements. And I'm talking about doctors, smart doctors getting hip replacements in their 60s, okay? Which to me is a sign that they're not as careful as they should be with their health. Sometimes it's bad luck. I'm aware of that too. Sometimes it's a medication side effect. I'm aware of that too. I know some other doctors who think they're real smart, but they've got, cancer, multiple types of cancer at a young age, and there's a lot of reasons why that could happen. But in general, I think it's often because they're eating a lot of high-fat food and fried food. Another smart male doctor, let's see, on the Mediterranean diet, in his 50s, but since his 40s, morbidly obese and diabetic. I offer to help him, but he doesn't want to hear it because he says the diabetes medications are a lot better than they used to be, and he loves his food. Real genius. Another smart male doctor, Mediterranean diet, fried food, fat. So what I'm basically saying here is the vast majority of these doctors don't know how to help themselves. How are they going to help the patient if they don't know themselves how to eat? And they have problems. They have the same problems the patients do. A little bit less. They're a little bit smarter than the average bear, but they're not doing so great.